Hi, I'm Cindy Chancellor, therapist with SIMEDHealth Physical Therapy Department. I also oversee our Southern Market Physical Therapy Division located in the Ocala and Lady Lake regions. Over prolonged periods of poor posture, it changes how we weight bear through our spine. During that process, weight bearing incorrectly causes muscle imbalances that causes tightness on certain sides of our trunk and weakness on other sides of our trunk. With that, it increases the disc compression and can cause periods of acute and then eventually chronic back pain if not addressed. Picking a chair that fits you correctly, making sure that those feet are flat on the ground, that your knees are at your hip level, and that your buttock and your low back are pressed firmly against the back of the chair. If you're spending a majority of your time in standing, then make sure that your chin is over your shoulders, in other words, not protruding over your chest, and that your belly is tucked in and you have a slight squeeze on your shoulder blades, so not to slump your shoulders in a rounded position. If working with a monitor, you want to make sure that your monitor is set right in front of you, not off to the side one way or the other. And you also want to make sure that it's at eye level to avoid looking downward or looking up for extended periods of time. Identifying the problem of your posture deviation would be your first step. Obviously, a physical therapy could address these issues with an evaluation, at which time they would look at your overall posture, which will then determine what is tight, what is stretched, what is weak, and what isn't moving correctly. They will then perform interventions such as joint mobilizations, soft tissue mobilizations, and then give you a nice home exercise program with stretches and strengthening to continue to maintain and address these issues that they find during your treatment. You should always consult a medical professional before beginning any exercise program, especially if you're currently having low back pain. However, to start low level, there are many things like glute sets, pelvic tilts, and then you can move on as you master those without any significant exacerbation of pain. Go on to bridging, wall squats with pelvic tilts, and then some higher level things would be things like planks and crunches. There are also many things that you can do on the physio ball that work the core musculature. The first muscle that I tend to always stretch on most of my patients are their hamstrings because of where they attach, which is at the bottom part of our pelvis. When they get tight, they create a strain on the pelvis, which then in turn pulls on your lower spine. The next muscle I always look at and typically always stretch with my patients is a muscle called your iliopsoas muscle. It starts on your last two vertebrae of the front part of your spine. It cross sections through you to the front and ends at the front part of your thigh bone, or otherwise known as your femur. When that gets tight, think of it as shortening. When it shortens, it puts strain on those last two vertebrae of your spine. The last two that I tend to always look at and stretch with most of my low back patients are muscles called your piriformis and your gluteal muscles. They are located in your buttocks, and once again, because of their location, when they are tight, they have a big influence on the strain that's being put on your low back.